As many of you know, this is my final evening news broadcast. It has been an incredible 5.5 years.
As summer nears, CBS This Morning co-host Norah O'Donnell shares her melanoma diagnosis. During a routine pre-Thanksgiving checkup, the then 43-year-old learned she had melanoma in situ. Shocked and scared, she recalls receiving the news while holiday shopping, writing, "Tears ran down my face. I couldn't understand how this happened." Despite taking care of herself, she regrets delaying her checkup. Now, O'Donnell speaks out to raise awareness about skin cancer and the importance of early detection. Learn more about her journey and how she's handling this life-changing diagnosis. The shocking diagnosis. I had these yearly skin checks, and I had gone 2 years ago to my dermatologist, Dr. Elizabeth Hale. At the time, I checked some things and everything was fine, she tells People exclusively. 2 years later, O'Donnell realized she was long overdue for a checkup. During her appointment, O'Donnell's doctor identified 2 spots on her back that she wanted to take a deeper look at. She said that she'd send them out for a biopsy and be in touch after Thanksgiving. My family and I were in Washington, D.C. for the holiday when I received an urgent email from Dr. Hale, she recalls. She said that the biopsy came back and that she wanted to speak with me immediately. It was then that the journalist found out she had melanoma on her upper left back. I was like, "Oh my God," O'Donnell admits. But the doctor said, "It's 100% curable. The good news is we caught it early, but as soon as you can I want to see you, and we got to take it out with a pretty significant incision. It will be deep and will be stitched." So the really good news is that they caught it early and they treat it very aggressively. They make a big cut to make sure there's nothing else around it and not becoming invasive. I went back in the beginning of January and had the incision done, she continues. It was 3 layers of stitches, like 20 in all. It was a pretty big cut, and the good news is the margins were clear. It's scary. It's the first time medically that something happens to you that scares you. Being told she had skin cancer took a toll on the newscaster mentally and emotionally. It was really a wake-up call to me. My husband was very concerned. My kids were really worried. My 9-year-old son said to me, "Well, is there any chance you can die from this surgery?" And I was like, No, admits O'Donnell. Not being able to work out for 6 weeks was one of the hardest things. I was distraught. It also made me realize how much exercise is tied to mental health. I really was down in the dumps over the diagnoses, and then not being able to exercise had a big effect on my mood. After her diagnosis, O'Donnell began researching this type of melanoma. I found out that a lot of this melanoma in particular is caused by UVA rays and tanning salons, she says. I grew up in San Antonio, Texas. I ran track, I was a cheerleader, and I went to a tanning salon. That was in the days before spray tans. Now, I wear 50 or 70, I use spray tan or self-tanner. But that wasn't around when I was 20 years old. Following her diagnosis, O'Donnell stresses the fact that everyone should be taking preventative care more seriously. I think getting skin checks isn't at the top of everybody's list. We delay our preventive care, she says, adding that melanoma is on the rise. Preventative care is so important in catching this stuff early. I have to go back every 4 months now. I just went back and they took off 2 more things, including a spot underneath the scar. They both came back totally benign, but I'm under close surveillance. Norah O'Donnell has opened up about her shocking skin cancer diagnosis, saying that she received the news during a regular checkup with her dermatologist. The CBS This Morning anchor learned in November that she had a cancerous melanoma on her upper left back after her doctor identified 2 irregular moles and sent them out for biopsy. She admitted she was at high risk. I was very upset and cried about it and talked about it with my family who are doctors, O'Donnell told Inside Edition. The fact that I have number 1, fair skin, number 2, spend a lot of time in the sun, and 3, used a tanning salon, were all contributing factors. Melanoma accounts for just 1% of all skin cancers, but it's the most deadly, according to the American Cancer Society. Using tanning beds actually increases your chance of getting melanoma by 75%, according to the Melanoma Research Alliance and CDC. Within 2 months, doctors had removed the moles. She is now cancer-free and writing about her ordeal for the June issue of Good Housekeeping. "Don't be afraid to go to your dermatologist," she told Inside Edition. "It's so much better that we caught this early." What is melanoma? Melanoma, which means black tumor, is the most dangerous type of skin cancer. It grows quickly and has the ability to spread to any organ. Melanoma comes from skin cells called melanocytes. These cells produce melanin, the dark pigment that gives skin its color. Most melanomas are black or brown in color, but some are pink, red, purple, or skin-colored. About 30% of melanomas begin in existing moles, but the rest start in normal skin. This makes it especially important to pay attention to changes in your skin because the majority of melanomas don't start as moles. However, how many moles you have may help predict your skin's risk of developing melanoma. It's important to know if you're in a high-risk group for developing melanoma skin cancer. Because of the fast growth rate of melanomas, a treatment delay sometimes may mean the difference between life and death. Knowing your risk can help you be extra vigilant in watching changes in your skin and seeking skin examinations, since melanomas have a 99% cure rate if caught in the earliest stages. Early detection is important because treatment success is directly related to the depth of the cancerous growth. Melanoma accounts for only about 1% of all skin cancers, but causes the great majority of skin cancer-related deaths. It's one of the most common cancers in young people under 30, especially in young women. Melanoma incidence has dramatically increased over the past 30 years. It's widely accepted that increasing levels of ultraviolet exposure are one of the main reasons for this rapid rise in the number of melanoma cases. You can get melanoma in any area of your body. Melanoma can even form in your eyes and internal organs. Men are more prone to develop melanoma on their trunks, often the upper back. Women are more likely to have melanoma on their legs. Most experts agree that a major risk factor for melanoma is overexposure to sunlight, especially sunburns when you are young. Statistics tell us that 86% of melanomas are caused by solar ultraviolet rays. How does the sun cause skin cancer? UV exposure can cause damage to a cell's DNA, making changes to particular genes that affect how cells grow and divide. The potential for problems comes when your skin's DNA is damaged and those cells start reproducing. UV radiation from tanning beds also increases the risk of melanoma and has been designated as a carcinogen, cancer-causing, by the World Health Organization. Tanning bed use may be related to over 6,000 cases of melanoma per year in the United States. If you have a mole or other spot that looks suspicious, your doctor may remove it and look at it under the microscope to see if it contains cancer cells. This is called a biopsy. After your doctor receives the skin biopsy results showing evidence of melanoma cells, the next step is to determine if the melanoma has spread. This is called staging. Once diagnosed, melanoma will be categorized based on several factors, such as how deeply it has spread and its appearance under the microscope. Tumor thickness is the most important characteristic in predicting outcomes. This is exactly what had happened to Norah O'Donnell on one unassuming morning. O'Donnell discusses melanoma. In an interview with Healthline, CBS News correspondent Norah O'Donnell discussed her experience with melanoma and the importance of preventive medicine. O'Donnell is the anchor and managing editor of CBS Evening News, delivering essential medical and political coverage throughout the COVID-19 pandemic and the 2020 election cycle. It's been more than 4 years since O'Donnell received an urgent call from her dermatologist while admiring the sheets and towels in a department store. When her doctor told her that she had melanoma and would need surgery to remove it as soon as possible, she felt an instant dread. Since the surgery, O'Donnell has been diligent about getting checked for skin cancer every 4 to 6 months, but fears this may not be the case for others. She's concerned that people are falling behind on their preventive doctors' visits due to the ongoing COVID-19 pandemic. Although some people are nervous about entering a medical setting for a checkup given the pandemic-related physical distancing recommendations, it may be safer than many realize. One of my own doctors actually said a hospital is one of the safest places to be because there is universal mask and glove wearing, O'Donnell recalled. She hopes learning about her story will inspire others to take a proactive approach to their health during these challenging times. O'Donnell said that although her doctor detected the melanoma very early and the surgery was relatively minor compared with other skin cancer surgeries, she now understands the uncertainty of cancer in a more personal way. She describes the scar on her back as a reminder that regular checkups can save lives, adding that when it was healing, "My kids helped me put lotion on it, and now when I tell them to put on sunscreen, they understand the seriousness." O'Donnell's brush with mortality has affected how she reports on health stories. "It's made me incredibly empathetic and emotional," she said. Since her diagnosis, O'Donnell regularly uses her platform to speak about the dangers of tanning and sun exposure. She has a drawer by her front door filled with sunscreen, and her children know not to come home with a pink face or neck. After learning more about melanoma, she was especially struck by the dangers of indoor tanning beds, which can increase the risk for melanoma by 20%. She recalled how she and her friends wanted to be tan as teenagers growing up in San Antonio, Texas. "We were certainly vain like teenagers can be. It's important to leave the vanity behind and care more about saving your life," O'Donnell said. When O'Donnell first spoke publicly about her experience with melanoma in 2017, people reached out to her saying she inspired them to get screened. Several whose screenings led to a discovery of skin cancer thanked her. "That was the payoff in sharing my story," she said. During the COVID-19 pandemic, O'Donnell has watched news media turn into a public health service, disseminating new information on the virus, effects of transmission, and vaccine development. She hopes to continue this service by making the news a place for information on other illnesses, like melanoma. Over the past year, there's been a heightened sense of awareness about things like a cough or a runny nose, O'Donnell said. I hope in some ways there is a heightened sense of awareness about the rest of our health, too. Last week was the first week we didn't have an election, an impeachment, or an insurrection, you know? So I actually had several doctor's appointments of my own, O'Donnell said in February. It isn't easy to do your job at work, take care of your family, and then schedule appointments. She said her long-term goal in life as a reporter and a mother is to change the relationship many people have with personal health. Visiting a doctor isn't just for when you're sick. We should be visiting doctors when we're healthy so we don't get sick, O'Donnell said. We have to be going more regularly to get skin cancer checks, mammograms, and pap smears. We need more regular visits with therapists and mental health experts. As many people are receiving the COVID-19 vaccine, O'Donnell hopes there will be many returning to dermatologists and other doctors' offices for preventive medicine visits because catching conditions early can save lives, and you just can't repeat that enough. Now that she has survived such an ordeal, what is Norah O'Donnell doing now? O'Donnell worked as a staff writer for Roll Call, where she covered Congress. She spent 12 years of her career at the NBC networks. A commentator for The Today Show, chief Washington correspondent for MSNBC, and a White House correspondent for NBC News, O'Donnell was also a contributing anchor for MSNBC Live and an anchor on Weekend Today. O'Donnell reported for various NBC News broadcasts, including NBC Nightly News, The Today Show, Dateline NBC, and MSNBC. O'Donnell filled in for Chris Matthews as host of Hardball with Chris Matthews and was a regular pundit for The Chris Matthews Show. Since joining CBS, she has served as anchor in several of its highest-rated shows, filling in for Scott Pelley on the CBS Evening News multiple times, the first being October 10, 2011. She was chief White House correspondent in 2011 and 2012 and became a co-anchor on CBS This Morning in the fall of 2012. On May 6, 2019, Susan Zirinsky, president of CBS News, announced that O'Donnell had been named anchor and managing editor of the CBS Evening News beginning on July 15. She would also be the lead anchor of political events for the network and continue as a contributing correspondent for 60 Minutes. She became the third woman after Connie Chung and Katie Couric to serve as the program's weeknight anchor. Her last broadcast of CBS This Morning was on May 1, 2019. On April 8, 2022, O'Donnell extended her contract with CBS News to remain as anchor of CBS Evening News through the 2024 election and afterward. In May 2024, O'Donnell interviewed Pope Francis in Vatican City for 60 Minutes. The interview made headlines for the Pope's discussion of surrogacy, gay marriage, and female priests. In July 2024, O'Donnell announced that her tenure at CBS Evening News would end following the 2024 United States presidential election, after which she would become a senior correspondent for CBS News. On November 22, 2024, Norah announced that she would be leaving CBS Evening News on January 24, 2025, which was later moved up to January 23, 2025, due to coverage of the 2025 Farmers Insurance Open. O'Donnell lives in Washington, D.C., and New York City's Upper West Side neighborhood with her husband, restaurateur Jeff Tracy, owner of D.C. restaurant Chef Jeff's, whom she married in June 2001. They met while attending Georgetown together. On May 20, 2007, O'Donnell and Tracy became the parents of twins, whom they named Grace and Henry. Their third child, daughter Riley Norah Tracy, was born on July 5, 2008. O'Donnell said that her daughter's first name had been suggested by Tim Russert, who died 3 weeks prior to Riley's birth. O'Donnell and Tracy made a cookbook for parents titled Baby Love, Healthy, Easy, Delicious Meals for Your Baby and Toddler, released on August 31, 2010. In the fall of 2016, O'Donnell was diagnosed with melanoma in situ, meaning the cancer was contained to the epidermis and had not yet spread to the dermis and metastasized. She underwent surgery soon after where a 3-inch-long piece of skin from the upper left corner of her back was excised. She later stated that she gets regular skin checkups every 3 to 4 months and multiple skin biopsies due to her high risk. In the years since her diagnosis, O'Donnell has become a skincare advocate, encouraging others, especially women, to get regular dermatological checkups and take better care of their skin by practicing good skincare routines, such as using sunscreen. She discussed her diagnosis with her dermatologist live on CBS This Morning in 2017. Washingtonian magazine has named O'Donnell as one of Washington's 100 most powerful women. O'Donnell has also been named to Irish American Magazine's 2000 Top 100 Irish Americans list. O'Donnell won the Sigma Delta Chi Award for breaking news coverage for the Dateline NBC story, DC in Crisis, which aired on the night of September 11, 2001. She won an Emmy as part of NBC News' election night coverage team in 2008 for outstanding live coverage of a breaking news story, long form. O'Donnell's impressive career is matched by her dedication to advocating for issues that matter to her personally and professionally. Her battle with melanoma has fueled her commitment to raising awareness about skin cancer and the importance of early detection. She frequently shares her story to inspire others to take preventive measures, emphasizing that her experience could save lives. What do you think of Norah O'Donnell's encounter with such a deadly diagnosis? If you want to see more videos like this, make sure to leave a like, subscribe, and comment down below to let us know your thoughts.